our recording. And welcome everyone to our March policy forum. As I said a little bit earlier, I can't see anyone's screen, but I can see that we're filling up here. To anyone who joined us at the conference last week, welcome back. I hope you are, feeling well rested and very grateful that y'all jumped right back in here. Jen, thank you for putting in the chat just to introduce yourself and letting us know where you're visiting from. I'll add, besides just writing where you're from, let's throw in the chat, if you care at all, who you think is going to win the tournament this year, the NCAA tournament. And I will pretend like I still know anything about college basketball. Unfortunately, I don't. But other than that, Jen, I'll let you take it away for a quick welcome, if that's okay, as we begin our meeting.
Nice to see some new faces here, and thank you all for taking some time out of your day to join us and talk about all things policy related here in the U.S. Sometimes we've got some folks joining internationally, but typically this is a pretty U.S.-based crowd because we're talking about how we can affect change as a community in the U.S. Through policy. And I think a great example of how we can get this done is by connecting research, and I'm borrowing some words from Susan Carlson here, research to policy to practice. And policy really is that key linchpin that takes that research and turns it into practice that we see in our clinics, we see in our day-to-day. So I'm joined here by some FASD United staff. Chris Melfi, obviously, our policy coordinator extraordinaire, Susan Shepard Carlson, who chairs our policy committee, former chair of our board, will be giving you the lay of the land today. We also have Musa Camara from our affiliate network here. He runs our affiliate network. And let's see, Kristen Erickson, one of our family navigators, is also on the line, as well as Heather French, who runs our family navigation program. So lots of FASD United representation. As an organization, and I don't know if you want to change slides, we've got a lot going on right now. Just recently, we published a white paper that was created as part of a white paper, for those of you that are not in on the lingo, is kind of a report. A report gathered in this particular instance from an event that we threw back in September that looked at the federal recommendations on FASD that were done back in 2009 and how we could update those with where we are now as a field and what do we need to do to move forward. That's available on our website, and a lot of you that are here contributed to that, and I want to thank you for that. We recently published a stigma and language guide. I want to make sure you have access to that also on our website. We publish state data sheets that gives information for each state on how FASD is handled in that state. Those are all great advocacy tools. All of those are being updated right now, and we'll be pushing out more information as they update and requesting feedback from all of you to make sure that they are serving the purpose for which they're intended. Next slide, please. We did just complete, I'm going to go ahead and let Musa go first. Musa?
Hey, thank you. Good afternoon, everybody. Hope everybody is well. Currently, as far as for our affiliate update, we have 48 affiliates with various sector differences as far as what exactly their focus is. Majority of our affiliates are focused on advocacy and training, and with the in-between as far as consulting family, parents, and youth. We currently just added 2 new affiliates, one from Maryland, Frederick County, and the other one from Illinois, Camp FASD. So if anybody does have any interest into our affiliate network, please reach out to me. My email is, I'll put it on the chat too as well, but my email is kamara@FASD or FASDunited.org. And I can share more information as far as like what are other activities that we do about Impact Week. I know probably Jen alluded to other things with you guys when you guys was at the conference, but I'd love to share more information about our network and just how you can be a valuable member. Jen is on you. Jen, are you there?
Thanks,
Sorry.
Melissa. Maybe there's an, oh, you got it, Jen?
I got it. I had to
Nice.
unmute. We did just finish up the International Research Conference on FASD in Seattle. It was great. It was a smaller, more intimate conference this time. And I think one of the big takeaways I got out of it is the power of connecting to other people working in this space. I think it's really important that we that we do connect and we do understand what each other are doing. We have dates already for next year. That'll be April 16th through the 19th. Next year will be the 10th International Research Conference on Adolescents and Adults with FASD. So next year we'll have a full track for people with FASD, designed by people with FASD to participate. A lot more family oriented, but as well having the hard research there, the core research there to engage with and see how we can move the field forward, see where policy can meet up with research to put it into practice. And that'll be held in Seattle next year, and we will be pushing information out on registration as soon as it's available, but definitely mark those dates down on your calendar. So next slide, please.
Jen, if it's okay, if we just stay here for just a second. I just want to just talk about, some very high level lessons learned from the conference, because this is my second year attending the conference, and I was surprised at how much, perhaps I shouldn't have been surprised, but how interested a lot of the researchers I spoke to were in connecting their research to policy. Of course, there are concerns over what sort of advocacy they can do, where exactly the line is, but I was really, really encouraged to hear the amount of researchers, particularly younger researchers, who are interested in making sure that they are resources for our legislators. Got a lot of questions about how they can participate in advocacy without making the ask. And we have, thankfully, some great examples of how that works, thanks to Texas, for instance, thanks to Dr. Petrenko. So there are definitely clear opportunities for researchers to engage. And I really think that the researchers will play a critical point in moving advocacy forward. We learned some lessons regarding this out of France, actually. There is a clinician, an advocate, who has been working in France on a small island actually off the coast of Africa, further away from the African mainland than Madagascar, that is part of France. He's been working there for 30 years on FASD and FASD legislation. And what they've been able to do is reduce the prevalence of alcohol-exposed pregnancies significantly, not only compared to levels 20 years ago, but also compared to mainland France. And one way they were able to do that is by getting researchers fully engaged in the advocacy process, and making sure that legislators know that they are totally available as a research. They highlighted that as one of the catalysts for getting legislation passed. And that was just an interesting lesson learned, and something that is making me very, very excited for FASD Impact Week, where we'll have a chance to do just that. You can go ahead, Jen.
Yeah, well, and before we move on, I don't know if anybody else had any takeaways from the conference that were policy related, but definitely feel free to put that in the chat, because I think that is such an important piece, is that we can't do this in a siloed way. It can't just be the parents, or just be the agencies, or just be people with FASD doing it, or just be researchers. Policy really cries out for a multidisciplinary approach, a multifaceted approach.
Yeah, thank you, Jen. And, I'll just keep this going a little bit. In the session put on by France, they mentioned another main factor in getting legislation passed was sliding up next to the alcohol industry, which we know in this country it will be contentious, is very difficult. But they were able to frame the issue of prenatal alcohol exposure and FASD to the alcohol industry in a way that made them seem like heroes. They had a chance to do something good. And somehow, some way, they got the alcohol industry fully on board with their efforts. So now with what's happening in France, particularly on Réunion Island, is that anytime alcohol is mentioned, is brought up, and relates to pregnancy in any way, or even people who are able to become pregnant drinking, the message from the alcohol industry has to be mandated by law. There is no safe amount of alcohol. If you are pregnant, you should not drink. And that is the message that has to be put out there. And that's coming from 30 years or so of work done there. That is a lesson that I took from Denis out of France. The second lesson, and I would like to open it up if anyone else has any points to make who sat in there in that session, is that there's a real appetite on a global level to move FASD and alcohol policy in the same direction. I was very happy to hear that, and something that we hope to act on moving forward. I know directly following the session with the French group, Denis asked for everyone in attendance to, if they felt like what they learned was helpful, to send him a message saying so. So essentially, he can show that to his MP when he's in France next week. So it's good to know that there's an appetite to move forward. And I think if we can show that to our local, our state, and our federal governments, it'll help momentum and show that this is a very popular movement.
Excellent. So coming up, and please put this on your calendars, we have FASD Impact Week. This is a free week, a free conference that we host every September in Washington, D.C. Registration is now open and available for that. And we start off with the symposium that creates the next white paper, updating the recommendations for FASD policy in the US. We have a Hill Day, incredibly powerful to go up to the Hill and have a couple hundred people walking around with FASD shirts on. It helps with visibility. It helps with moving things forward. It helps with awareness and understanding. We also have our Red Shoes Gala, which is our largest fundraiser of the year that helps, and the fundraising from that helps support the policy work we do. And then on Wednesday, we have some workshops by the team that's working on the Department of Defense's response to FASD and setting up hub and spoke diagnostic clinics for military healthcare beneficiaries. And we're going to have some other emerging research coming out, specifically in the foster care space. We spoke, there's some research that's coming out through Association for Community Living and James Bell and Associates, and that they're going to be presenting that afternoon as well. So just lots of opportunities to engage, connect, and you couldn't ask for a better price for a conference, which is free. So I really hope that all of you will sign up and be there as you're able to.
Thanks, Jen. And Impact Week is a great opportunity to show our legislators and to show the nation really that this is a united movement made up of self-advocates, caregivers, educators, people working on the state level, researchers. Everyone working in the same direction can be extremely powerful. And when you get in a room with a legislator, with their staff, and you have all of these different sectors coming together to basically say the same message, that support is needed, awareness is needed, that can be very powerful. And I'm really looking forward to that. Thank you, Jen.
All right, so on to the main event. The FASD Respect Act has been introduced in the Senate, not in the House yet. We are working on that, but this is language that would reauthorize FASD programs and help provide not just funding for research, but funding for education, awareness, and services across states. It supplies funding and parameters for building state and tribal systems, and also reauthorizes the long dormant Centers for Excellence on FASD that put out a lot of good information and support on FASD that unfortunately was defunded a while back. So that's the bulk of what we're going to talk about today. Chris, I'll pass that back over to you.
Thanks. And not much in terms of status of the bill has changed. As I'm sure everyone is aware, March was a bit of a hectic time up on the Hill. They had their hands full for sure, dealing with the budget and dealing with a new administration coming in. So there's not much to report on status of the bill. It is still in committee, and we do hope it will be heard. But I do want to spend the bulk of this meeting talking about work that's been done, work that still can be done to make sure that awareness grows. But I think it's important to recognize that, again, progress has been made, and it might not be quite the progress we want, but any mention of FASD is an opportunity to educate, is an opportunity to thank those for bringing it up. So I just want to talk about a few instances of that very thing. So in March, we saw that Senate Amendment 1232 to S331, I really enjoy saying that, was proposed by Senator Hassan out of New Hampshire. This was an amendment that was proposed to the HALT Fentanyl Act that would include the FASD Respect Act language, so provisions from the FASD Respect Act, as well as the Support Reauthorization Act inside the larger HALT Fentanyl Act. This essentially took no active advocacy by us, by you, and I say active just because, of course, it's been years of advocacy that led to someone like Senator Hassan including this amendment without us going and yelling in her ear to do so. So that is just one way that we were able to take a seat at a table that otherwise we normally wouldn't be at. We also heard remarks from Senator Tina Smith on the continuing resolution, which I want to play very quickly here. It's only a 1 or 2 second clip. And
it cuts bipartisan support, it cuts funding for fetal alcohol syndrome and for Alzheimer's.
So that is a very short clip. I hope everyone was able to hear that. But the reason that I played it is because we now have a senator who is very well known in the Senate, who for all accounts and purposes is popular, bringing up FASD unbidden. I will comment a little bit on her comment after we get through all of these, but again, that just shows that FASD is taking a seat at the table, again, in places where it normally isn't. We also saw in March the Bipartisan Healthcare Act being introduced. This was introduced by Senator Ron Wyden out of Oregon and Senator Bernie Sanders, both very influential on the Senate Health Committee. This is a package of healthcare bills that was meant to be included in the CR at the end of 2014, so 2024. So at the end of the year, there was that continuing resolution that came out. It was quite lengthy. It had support from 4 corners or leadership from both parties. Of course, it was never voted on, but this bill included and does include the FASD Respect Act language. Very similar to that amendment to the HALT Fentanyl Act. We were not going to Senator Sanders or Senator Wyden asking for this to be done. It just builds on the advocacy that you have all been doing for so long. And now we are seeing the results of that. We have another comment, this time coming from the Illinois state legislator. I'm just going to play this very quickly. This is Jed Davis.
Yeah, I got a fetal alcohol syndrome bill to kind of help people that grown up under that, diagnosis get the help that they need younger, instead of just kind of getting lost in the system. Then they become 20 and 30 and they're dealing with all kinds of life issues that could have been rectified had it been addressed.
So again, another comment coming from a legislator specifically on FAS, but we will talk about that in one moment after we talk about our final chair of March, the Supporting Adopted Children and Families Act. This is S-600. This was introduced by Senators Klobuchar and Kramer. Senator Klobuchar, as we know, a champion for FASD, a champion of the FASD Respect Act. Senator Kramer, someone who advocates have passionately reached out to. Again, we were not going to them asking for inclusion in this. It is the hard work, the dedication, the loud voices that made sure that we were including these bills, again, without active advocacy, which is what we really need. We need awareness. We need people other than those on this call, than caregivers, than parents, than self-advocates, to start caring, essentially. 2 notes on the public mentions that came from Senator Smith and State Rep Jed Davis. I'm sure you noticed that they both referred to FAS, fetal alcohol syndrome, as opposed to FASD. I would assume that this is a product of years of an overfocus on FAS, lack of awareness overall of FASD. I see this as a great opportunity to reach out to both of them, to thank them for mentioning FASD, for mentioning prenatal alcohol exposure, rather, thanking them for doing their part to raise awareness, in Representative Davis's case for proposing and introducing a bill that will set up a task force that mimics other FASD state legislation, but also to maybe gently remind them that FAS does not comprise all of FASD, and that by only speaking about FAS, while we're not negating the existence of FASD, we are delegitimizing perhaps their experiences they have. It's a great opportunity, again, to thank them. We want to make sure that we're thanking those who are expanding their table, but it's also an opportunity for a little bit of soft education. Jen, is there anything you wanted to add to that? I feel like you had some thoughts on this part in particular. Totally fine if you don't.
Having some language guidelines, and this is something that we're going to be working on internally too, is, with the stigma and language guidelines that we have, having maybe a smaller policy related one that we can share with legislative offices, so that when they are doing the great shout outs that they're doing, they're using language that is maybe more appropriate to what we know now, as opposed to what was known back in the 80s for FASD. And I don't know why my thumbs keep going up on my screen. I apologize in advance. Apparently my motion sensors are working overtime today, but I think one of the cool things I've been seeing this year, I have an alert set on congress.gov that anytime fetal alcohol, FASD, our bill numbers, anything like that is mentioned, or there's any movement on any of those things, I get an alert. And in the past, I would very rarely get alerts, and I'd kind of know in advance before they were coming. And now I'm seeing it ping regularly. And that is indicative of the movement that we're seeing, that people are getting engaged with the topic. They want to be a part of it, and they want to support, and how often we're being mentioned in legislation and being brought up for consideration in larger bill packages. Because as we all know now, the House and Senate don't pass bills. Like, you write a bill, they don't pass that bill. The House and Senate pass packages of bills. And so us being brought up that many times just shows how often we're being brought up for consideration in these package bills. And I think that bodes really well for us, and shows, again, it's a result of the hard work of everybody here.
Yeah, thank you, Jen. I appreciate you saying that, and that's totally spot on. We need to keep making noise so we are heard. But I think it's important that we do this, as our last chair drops, in a focused way. So in a way that will make sure that we're heard and understood. I know that I picked this little image here just because I knew it would make Jen happy, but it's true. We need them to hear us squeak. And we do that by standing up, by showing up, and by speaking up. Again, it needs to be focused and driven for a few reasons. If it's not focused and driven, we aren't really making a point. We aren't offering a fix. We aren't offering a solution. We are showing, sure, the realities and the complexities of FASD. But when we're talking to legislators, they are problem solving all day long. And I think, like it or not, they kind of need concrete solutions, concrete realities. And so we need to offer those to them. So if we are going to, continue to use the squeaky wheel analogy, we don't want to be set aside. We don't want just a little bit of oil rubbed on the wheel, put in the back closet so they don't have to pay attention to us, which is possible to happen if we provide a problem without any solution, or if we jump into being hypercritical. If we offer a solution to the broken wheel, the tools they need, the supports that would help you as a caregiver, you as a researcher, an educator, a self-advocate, a clinician, whatever it is, what would success look like for you or your loved ones? What does success look like for somebody else in a different community that does receive supports? Where can these changes fit into the existing system? So essentially, what tools could they use to fix the wheel, rather than simply wheeling us into the back closet so they don't have to listen to us anymore? I think this is something that can be applied not only to our meetings with legislators, but if we are to branch out to other forms of advocacy, like letters to the editor or op-eds, it's important to present the issue that we have, ways that it can be fixed, and ways that will benefit absolutely everyone. We do recognize, however, that the advocacy process is exhausting. It can be exhausting, and that it's often, like I said before, self-advocates, caregivers, moms, dads, researchers, people who are so deep into this field that it can start to feel overwhelming. But you need to remember that you do have an entire community behind you. Just as an example, I was exhausted last week working at the conference, but the spurts of energy come when you just see the fantastic community around you, all working towards a similar goal and willing to kind of pick up where you need it. I hate to keep going back to the Texas group, but why I'm so impressed by them is because they have a plan, they have roles, and they all support each other, so they don't end up being wheelie tired, as we see here. So as I mentioned, that there's multiple ways that we can advocate besides meeting with legislators. So I want to talk about op-eds and letters to the editor, but the points I make here should apply to any sort of communications you're doing about FASD, prenatal alcohol exposure, or the supports needed for this community. As a very, very quick high-level overview, op-eds, in case you're not aware, just because a lot of people don't read a physical newspaper anymore. Op-ed means opposite the editorial. It's where it would have been physically in the newspaper. These are usually written by a subject matter expert, which, in my opinion, all of you are in one form or another, either as a self-advocate, a caregiver, a professional, a researcher, whatever it is. They have a clear, concise point. They're making one point and they're backing it up with research, with facts, with their own experience. And then there's an overarching topic. Then there's a specific theme that will be present in there. For these to really have any sort of impact, they should be tied to a current event or, in particular, something of local interest. and they're usually 800 words or less. They can certainly be less than that. A letter to the editor, on the other hand, is in response to a specific article or an event or a published piece of material, something that's been put out there, and you, as someone with experience, is responding to that to offer your own opinion. You don't need to be a subject matter expert to this. It just needs to be something that affects you. And just like with the op-eds, it's important to tie it to something local, something personal. And of course, it has to be totally backed up by facts and research. As an example, here is how you can start crafting an op-ed with the overall topic, of course, being FASD. The specific theme that I chose here in his example, it's pretty broad, but it's something that you can definitely work within. Suitable supports will lead to improved outcomes. That's not really a hot take. I don't think anyone would be surprised by that. But you can offer them a hook or something that will grab their attention for you then to further elucidate your point. Here, the hook that I went with was only 10% of individuals with an FASD exhibit the characteristic dysmorphic facial features consistent with an FAS diagnosis, which some label as more severe. Paradoxically, this can lead to improved outcomes due to increased supports tied to more physical manifestation of symptoms. I think within our community, this isn't going to be groundbreaking news, but to someone outside of the FASD communities, to someone who isn't aware of FASD, and I speak for myself, I'll say 5 years ago even, my brain goes to FAS immediately. And I wouldn't assume that those with an FAS diagnosis sometimes have improved outcomes compared to those falling under the FASD umbrella. So I think this is a good opportunity to share not only the difference, why awareness of FASD is needed as opposed to a hyper focus on FAS, but it also presents the idea that their suitable supports can lead to improved outcomes in a way that is attention grabbing. A second example that we can look at, of course, again, the topic is always going to be FASD here, with the theme being that the federal and state response to FASD must be comparable to support for autism. This could be a letter to the editor. This could be an op-ed. I think it's safe to assume that there will be articles written about support for autism. And this is a good opportunity to make sure that awareness for FASD is growing as well. The hook I chose here was conservative estimates show a prevalence of 1 in 20 for FASD compared to 1 in 36 for autism spectrum disorder. Yet federal funding for ASD outpaces FASD funding by billions of dollars over the next 5 years. To me, 1 in 20, eye-grabbing. Billions of dollars over the next 5 years for autism spectrum disorder, that gets my attention as well. I think if you're going to go this route with this sort of communication, this sort of argument, it's really important that we aren't antagonizing other movements, militant against other disabilities. We need to make sure that we're providing a unified front, that we are in coalition with other disabilities, with other movements. And the way I would do it with this specific argument is not by saying that, hey, you need to cut funding to autism. It's more saying we're in the same boat. Why are these individuals more worthy of support, more worthy of our care than these individuals? We can also make the point that there are certainly those who receive an autism diagnosis, even though an FASD diagnosis of some sort would provide more accurate supports, but it's the only thing they have. This might take away needed supports from those in the autism community, and it's also not providing those with an FASD with FASD-informed supports. It's very easy to then tie this to an economic argument of providing an upfront investment in the dignity of people's lives and valued members of our society, rather than having it be a cost on the back end in the form of healthcare, corrections, education. The list could go on and on. Jen or Susan, I want to just give a quick second and ask if you have anything to add here before I kind of open it up to the floor a little bit. Keeping in mind, if you're shaking your head, I cannot see you.
Again, I think it is, particularly on this topic, it will be very important that we come up alongside as opposed to coming in direct conflict with the autism community, making sure that we are not looking to take anything away from, we are looking to add on to and ensure that what affects one of us affects all of us. And I don't know, Susan, if you have any other thoughts on that.
Well, I think both of you have stated how we should, I know how we should deal with this. And I know we've talked a lot about this in our policy team meetings. And I don't know whether this is a good argument now in this environment, but it's really a equity is, and I think you said that in how you framed it, Chris, but you have similar neurodevelopmental disabilities, and one is unrecognized really by the federal government in their funding and in its investment. And it's also, if you do, the upfront funding, you can point to, like with autism, they've gotten the support, so the social outcomes have improved. And that would be the same argument that you would have for those with an FASD. So where you're going to save money down the road.
Thank you, Susan. I'm going to go ahead and stop sharing for a few minutes. We have a few slides left where we're going to talk about some happenings from March, what we're looking forward to in April, and the general political landscape. But I was hoping to take just a few minutes if anyone is interested, and maybe walking through some different examples of pieces that we could, opportunities for communications like this. But Liz, let me just give you the opportunity to speak before we.
Yeah, I just want to make a comment on the previous discussion. I'm not sure whether any of you heard the clip of President Trump talking off cuff about RFK's kicking off a study, research, what have you, into the fact that the MMR vaccine is the cause of autism, which of course everybody knows was debunked research. But anyway, so there's this clip of President Trump commenting how is it possible that 1 in 36 Americans are diagnosed, children are diagnosed with autism every day. And all I could think of was, wait a minute, there's something that we can do here. Like how did he get that clip of him? Somebody gave him that clip of information, and it was just for people to hear that. That sounds like a lot. And I don't want to get into politics here, the politics of the situation, but that was very compelling to people who don't know the background around, why you might want to do research, even if they don't know it's debunked. So I just, that was a really cause for pause moment for me, to think that here's this guy, somebody gave him that. And it was accurate too. He had the right number too.
Well, Liz, why don't we use this example and formulate an op-ed, an op-ed piece essentially. So let's say that is published in a newspaper. We have the topic, obviously it's FASD. What the theme is seemingly the prevalence of FASD is 1 in 20 compared to, let's say, autism at 1 in 36.
Yep.
Awareness does not match prevalence. Where can we go? What are some relevant points? What are hooks? What is going to make this point strong? And we don't have to pin this all on Liz. If anyone else wants to to come in as well. So I will say right off the bat that we had a meeting. Joel, thank you. I'll definitely let you in there. We had a meeting with Mark Wayne Mullen, Senator Mullen, out of Oklahoma, 2 weeks ago, and it was because he made a very similar point. He said something along the lines of 1 in 36. If that's not a pandemic, I don't know what is. And we had a very productive meeting. I felt, and again, keeping politics out of that. He has some stances that I thought might have put him in opposition to this, but great meeting. So I'd love to hear your thoughts, Liz, and then we'll have Joel as well.
Okay. I mean, I gotta give it some thought. Obviously not right this minute, but unless that's what you're looking me to
No,
give us.
we've got Joel ready to go.
Okay.
Thanks, Liz.
Thanks. I don't know the statistics, but maybe it'd be helpful if we could find those, or if research has been done. My son's dual diagnosed because with autism, because of the social aspects. He doesn't have autism. He has the symptoms of autism. And so those 1 in 36, part of those numbers in my mind, when I first 8 years ago, when we began this process of understanding our son's diagnosis, it was 1 in 60. And now it's 1 in 36. And I think it's increasing because children like my son have a dual diagnosis. He has autism, and that autism goes towards the autism prevalence.
Sure. And I think that totally makes sense. That's a good opportunity to show and to explain that FASD informed specific supports are needed. So even though your son is getting the supports needed, the supports, is it safe to say it would be more beneficial if they were specifically tailored?
Oh, big time. But the fact is, we do get some supports, and that money takes away from autism, but it's much needed for my son. And it seems to me that more than 50% of the people that I know from an anecdotal standpoint that have a child with an FASD also have a dual diagnosis for their kiddo of autism.
Which I think is something we would have to be able to back up, right?
Right. And I don't know that there's any statistics or research, but anecdotally, in the last 8 years, it's at least 50% of the parents I've spoken with, their child has a dual diagnosis. And I was told, boy, you got the FASD diagnosis, that's the keys to the kingdom by way of supports. And they were really true. That's been really true. So anyway, it's
Thank you, Joel.
Yeah.
Thank you. I think it would also be safe to say that an uptick in diagnosis comes from more awareness as well. There's significantly more awareness of autism than there is for FASD. Sid, thank you for your patience.
We sometimes in our work with state and local agencies, rather than telling them what to do, we try to ask them questions about what they are doing as a way of documenting what they aren't doing. And one of the ways we frame the question is, do you think that your agency is devoting proportionate attention to prenatal alcohol exposure and its effects? In some cases, if they're honest, they say, gee, we don't have that data. And we say, yeah, that's kind of the point, that your one state agency collects information about 8% of pregnant persons using alcohol during pregnancy. And here's the statewide number, and here's the county number. Do you think you're devoting, given those numbers, those estimates, do you think you're devoting proportionate attention to prenatal exposure and FASD?
I really like that as a way to slide up next to them. You're not calling them out. You're asking them a question that is clearly elucidating your point. I wonder, how can that be turned into an argument that motivates the public to care? Is there a way? Is there an argument there that will kind of open the public's eyes to not only this issue, but the lack of action at the state level?
Well, when we talk to media people, we point out that lack of data. We give them the available data on what proportionate response would look like. And then we ask them, why don't you ask the Department of Developmental Services about their FASD enrollment? Why don't you ask the State Department of Education, given that we got legislation last year naming FASD for the first time under other health impairments, how many kids they identify, so that the question remains in the air. And even when they don't have an answer, that's a finding. They don't have an answer. They don't care enough to count. They don't know the available data on prevalence. There are 7 or 8 different sources of data in the state agencies that have some relevance to prenatal alcohol exposure, and they have never put that together across the agencies. So it's a way of brightening the spotlight on what they're not doing.
I think that would be extremely powerful. I really do. There's information there to be gathered that seemingly there's not enough interest or care to dive into. And I know Jen had mentioned our state data sheets, state report cards. That I think that is a good resource there to know what people are looking at and what they're not. Jen, and then we'll go to Carl.
Yeah, I think that Sid raises such a great point, though, and this holds true in advocacy, and I think it holds true in a sales strategy. I think we don't have to give even anecdotal information. I think presenting folks with facts, data, and then pointing out where the data is missing is an incredible strategy. And I just want to mirror Sid's points on that. I think having that question unanswered, we don't need to have all of the answers. We can have some of the answers and point out where there's big gaping holes in the data. And I think that's really a great way to frame things in a way that gets buy-in, investment. If we tell them, here's where it is, here's what the problem is, here's the solution, and we don't give them any space to be involved, we miss out on an opportunity of getting them connected with the issue too. So I really, really value Sid's points there.
Go ahead, Carl.
Well, as Joel knows, I like research. Preliminary research shows anywhere between 2.6% and 72% of those are with FASD or dual diagnosed with autism. Depends on which study and how old the study is. So it's definitely a point that needs further study. And the only way they really be able to get an accurate measurement of that is if they look at the health records, do a search through various health records to get that information. Because I'm sure there's quite a few kids that have an autism diagnosis that don't have an FASD diagnosis and likely should have them. So anyway, just as an information point. I like numbers.
Yeah, thank you, Carl. And before we move on to our last bit, if there's no one interested in doing this exercise, please just look at me blankly. But how can we, let's try to take Sid's argument there, Sid's idea of kind of highlighting where information is missing. How can we make that into an argument we give in person? How can that be an op-ed? And it's totally fine if we don't know, if we're unable to think about it, but I think or to come up with an answer, but I think it's important to have these discussions. And so we're not going into our advocacy sharing the same story we have been for years and years. Yeah, I think we're going to have to keep talking about this, and
it's a long-term conversation, I think.
Yeah,
it would be nice to have an op-ed and get it published, but I think it's a long-term conversation.
Well, thank you for engaging with that. I appreciate it, and we'll jump back into our last segment here, but always open for conversation. So please speak up if you need to. Okay,
I have a thought before you get going, based on Sid.
please.
How do we have those politicians champion that then?
How do we champion in
So
particular?
if the Sid is putting forth, let's draw them into the conversation, and the next would be to draw them out for action. How can you, Senator, take the lead on a national level to fill the gap? Or
I
a
think-
state level or local
Yeah.
level, whatever that might be.
I
That
think you
would
need
be
to
my
identify.
logical conclusion.
Yeah, and I think that's a good point, because you do want to have actionable items here. You do want something to come of it. I would say you identify the senator or the congressperson that you're going to give that message to. It could be someone in a district with a lot of research going on. It could be a senator from a state like California where there's been successful FASD legislation. I think that would make sense. Someone who in the past has enacted legislation, proposed legislation, based in science, based on research. I'm open to other ideas, Jen or Susan.
Well,
If
one of
you-
the things that I'm sorry, Chris, one of the things
Sure.
that they proposed legislatively here in North Dakota with their budget for the FAS Center is to actually study the impact in our prison system here in North Dakota. How many of those in prison have been prenatally exposed? And that's an interesting question, but it doesn't address any other numbers. It just looks at what's in the prison system. So it doesn't look at general population or any of those things. It just looks at prisons. So,
But it gets to the follow the money.
exactly. Yeah.
The budget is the policy, and if you know a legislator, and which
I agree.
committees they're on, then the appropriations hearing in that committee, the substance and the funding in that committee, where that legislator has a unique voice, an authorized voice. It's not just standing up in the legislature. It's in the committee work where the budget gets hacked out, where they can raise that opportunity to say, if we don't identify these children and parents early, we're going to see them in the system later. The work we're doing in San Diego County looks at the juvenile justice population, and we've documented 25%. Dr. Ken Jones at UCSD, kids that could have been diagnosed with FASD, they're now 18 to 20, incarcerated, trying to do community restoration. They're expensive kids, and we could have known before they were born. We could have known much earlier. That costs money. Follow the money.
Thank you, Sid. And that's a conversation that I know some find awkward or difficult, but it's a reality. Again, it's a reality of the complexities of FASD. And I think as an overall field and movement, we're getting better at discussing those things in a way that destigmatizes FASD. So again, I think that's a great opportunity to not only talk about that exact issue, Sid, but to do it in a way while at the same time you're educating on how to speak about it and the effect that can have on the overall community. Again,
If we ever could get a hearing in front of the committees, I would move heaven and earth to be there. So, yeah, even not as a speaker necessarily, just to be there to support whoever is at the table, because they need to hear the stories that we all deal with on a regular basis.
And I totally agree. And I would put forward that being the squeaky wheel, making sure that we are heard in any forum. Again, I know I talked a lot about letters and op-eds, but that's an opportunity to get us out there. Hill Day, again, Carl, that's not exactly what you're looking for, but
No,
we're
but it
hopefully
is-
we're gonna
yeah.
have 100 people, hopefully,
Yeah.
you know, all wearing an FASD shirt, all moving in the same direction. And I think that's incredibly powerful. And it's not a committee meeting, but if we show up in the right way and we're ready for it, I think it can have just as much of an impact.
Yeah.
Liz, do you have a thought still? I saw your hand went up.
I know we're running out of time here, but I was noodling on what you guys were talking about and the thing the gauntlet you threw to me. And I'm wondering, is this too provocative to suggest that, you know, President Trump calling after Bobby to go after why it's happening, 1 in 36, and we're going to figure out why that's happening, is, well, you know, don't, wait a minute, let's hold up on that. Let's figure out why FASD is, you know, more prevalent at 1 in 20. Can you put some money after that kind of thing? I mean, I'm just sort of noodling in my brain about that. Is that too provocative?
Well, I want other people to join in. I don't think
Okay.
provocative is in itself a bad thing, as long as it's not damaging, right?
Right.
First, do no harm, right?
Right.
In terms of stigma. It has to be true. I think there's a way to craft that argument, right?
Right. Well, the reason why I'm suggesting that is because the whole, I mean, this is my opinion, of course, but the whole notion of spending money to research something that's already been debunked is kind of a waste of money.
Yeah.
And that if they could, let's find something and put it in front of their noses that actually will draw attention to our thing. It doesn't take away from autism because at all, because it's about not wasting money. It's not about autism.
Yeah.
So I just, and then it would also then bring to bear the notion that there's a developmental disability that is, you know, also happening at a higher prevalent rate. You don't have to compare it to autism and say, let's work on that instead. So.
Yeah, Liz, that's a good point. And real quick before I jump in, I just want to thank everyone who came today. If you have to sign off at the top of the hour, totally understand. I'm more than happy to keep the conversation going as long as people stay in the room. Liz, the way that I would shape that argument, and again, I'm always open to hearing from Jen, Susan, absolutely anyone else in here, is I would say we ostensibly know the quote unquote cause of FASD. We know what happens due to prenatal alcohol exposure. Why don't we put this money towards identification and early intervention and supports for those with FASD rather than, you know, this misguided search for the cause of autism in the form of vaccines? That is in something that I would be super comfortable writing about, just because of our position as a national organization, as an organization that is somewhat reliant on federal funding. It's a strange time right now. I think there's an argument there. Hey, we know the cause of this, but you have to talk about it in a way where you're not focused on the drinking of the individual. You can say, hey, we know prenatal alcohol exposure leads to FASD. Let's put some of that money towards this great positive thing. I don't think it's super provocative. I think there's a way to do it. All of these require nuance and sticking with the, you know, core belief that first, our language should do no harm and should be factual.
Okay, and then also, can you just tell me who the other person was that said they would work on this? I lost that name in the process of this.
What's the question in particular? I'm sorry.
I thought you called somebody else who also volunteered to work on this particular thing with me. Maybe I misunderstood that.
Oh yeah, no, I just knew Joel had some thoughts, and then Joel came in.
Okay. All right. Never mind then. Don't worry about it. Yep.
If you're looking for volunteers, Liz, I'd be glad to connect.
Thanks, Joel. I appreciate that.
I'll put my info in the chat for you, because the Kennedy family is part of the NIH for funding on disability, so that would be a good angle.
Okay.
Kristen, it looks like you've had your hand up.
Yeah, I'm talking, so I gotta go. Thank you. For one, to you, Liz, somehow recently, Laura Bousquet, one of the other navigators, shared that Robert Kennedy's sister used to be involved with FASD United. Now, there's more than that, and I can look it up at some point, but I'm in my car, so I can't. But I don't know if anybody knows about that. But it's another piece of the, I know you brought Robert Kennedy up, and so I just wanted to throw that out. But I also, I'm so invested in what you're saying, but I've been driving. I can't even begin to be a part of the op-ed. But this conversation is so tremendous, and and your positive outlook on how things have been going lately, Chris, is just stupendous to me. Oh, there's Laura. I didn't know you were on here, Laura. So, but it did, beg to the question you were saying, that, I feel like there is still so many more connections that we can all use. And I agree with, it's partly in how we use the language that we use and how we do the not slighting autism, but to say exactly what we're saying, which is, I think that this is part of the problem, if you want to say, that's not recognized. And because it's not recognized, it keeps increasing the autism numbers. And yet this is something else, rather than, just continuing to throw money at something that is now getting funding. And, you all know what I'm saying. So thank you.
Yeah, thank you, Kristen. And I'm sure that everyone on this call has has understood this point, but I don't bring up autism prevalence or funding to denigrate or to say that, hey, we need more than they do. It's just to show a point that there is a group that's done this already, that's done it right, that are lessons that we can learn. They've created a framework, but essentially what makes one group of individuals more worthy of support than another? I think there is an argument there, and I just think we have to really be careful with our messaging to not upset a group like that, because they are large and they have power, and it's really a community that we want to partner with more than anything.
I agree, and I think it's one of the things that I feel very confident that it's more that we want to be included with them because it's another neurodiverse population, and it's more about having the right services and supporting anyone with neurodiversity, but it's not all autism, but it's not to slight them either. Yep. Thank you.
Thank you. And just one final point, I'm sure everyone got this as well. And we're not speaking about like the op-ed or a op-ed. This is more just advice, motivation on how to craft a message, where to get that message out to, and how to be loud. This is unrelated. I just want to say hi to Barb Weibrecht. Thank you so much for joining. It's always really, really nice to see you. I hope you're doing well. And I don't have too much else to add for this day. We've gone over. Susan, Jen, do you have anything in reserve? No, great. Well, I really appreciate everyone joining today. I know it was a busy week, busy month, busy year. So thank you so much for joining. Thank you for engaging in a conversation. I'm happy that everyone did engage, and we weren't dancing around a topic. I'm glad we got in to a real discussion rather than doing, as Susan says, admiring the problem. So thank you to everyone. If you have any questions, feel free to stay on and ask us or shoot me an email. Other than that, I hope I see everyone next Wednesday at our normal drop-in or later on in April for our monthly forum. Thank you very much.
Thank you.
Thank you, Chris.